I did a case study on how Arizona responded to COVID-19. And to be honest, I know nothing about Arizona previously. And I did some Google search and found this is a state with really gorgeous natural landscape. So I put some images here. And oops. So compare with other states. So this is the latest situation. We can see that Arizona is doing it's doing okay. It's not the worst cases, but it's also not the best ones. And oops, there's some summary data here. The total cases is about 207,000 cases, and here is the timeline of the new cases. And we can see that at the beginning, it is pretty flat, and it started to increase significantly after May 30 and reached to the peak in July the 1st. I'm talking about the new cases per day. And so the image below is the death cases. And so for the timeline, I'm going to talk about the big policy made according to the timeline of the new cases change here. And the first confirmed case happened on January 26th. And on March 11th, the state declared a state of emergency as a proactive measure to deal with the COVID-19 crisis. And the day later, they declared a public health emergency, but no plans to limit large public gatherings as governors in other states have done. So they are still allowing many people gathering together. And in the late March, they issued a statewide stay-at-home order. So far, things looks like going okay. And so in the late April, they announced a partial reopening to begin on May 4th, because it seems that the new cases per day seems pretty flat. And on May 15th, the statewide lockdown order expired. But then on June 1st, 2 weeks after the stay-at-home order expired, the state reported a record high of daily hospitalizations suspected to be related to COVID-19, with more than 1,000 hospitalizations. So that's when the thing got really worse. The new cases per day started to increase significantly. And on June 29th, the governors ordered bars, movie theaters, and gyms to close again in a partial reversal of the state's reopening. And also the state activated its crisis care plan for the first time in the history. And I did a search on what is the crisis care plan, but it seemed that they didn't review information to the press of what exactly this plan will bring. But it is like paid more attention to give the healthcare more resources to deal with the COVID-19 crisis. And then after the peak of the new cases, they keep issuing executive order extending the temporal closure of certain business for additional time. And also the order also prohibits organized gatherings of more than 50 people and pauses special events permit state-wise. And then the latest information is that despite the declines of the new cases per day, officials still warn the public to keep up the preventive measures over the Labor Day weekend, which is just passed. And they didn't stop a rally of the state capital calling for an end of all COVID-19 restrictions. And so far it seemed that the situation in Arizona got controlled. And I did search what technology intervention they did. And I didn't get much information on that. And there were two things I found kind of related to technology intervention. The first one is that Arizona Department of Health Services announced the launch of this hotline, which is the Arizona Surge Line. This is a new service for hospitals aiming to ensure COVID-19 patients receive appropriate inpatient placement so that they can arrange the resources of different hospitals accordingly and make sure that everyone gets medical treatment in time. And the next one is that the University of Arizona invented a device that seems to deliver the COVID-19 results in minutes. This is using a laser technology, but this haven't happened yet. And it is said that it is going to happen this fall. And I'm not sure what is the current situation of this technology. And yeah, that's all.
Let's clap for Xiaofei. Any questions for Arizona? Looks like not a very
I was wondering how did you make that animation of the timelines? I really like that. What a great way to present the information.
Yes, because I found that they really issued a lot of orders and I don't want to read them like line by line. So I just look into the special time points that seems there is a change of the statistic, and I put the related orders around that time point on the diagram.
That's really clever.
That was really cool, yeah.
Yeah, because besides the policy, I don't know what intervention makes the changes, because it seems that there is not much technology intervention happen there.
Just to ask, like, is it like just normal animation or is it something advanced going on to make this animation?
Oh, this is just really normal animation. I made it manually.
Focus on the COVID, not the animation.
Because I want to implement something like this.
I have a question about something. So Arizona, I actually lived there for a couple of years. It has, I think ASU is one of the biggest universities, if not the biggest university in the country. So obviously starting school was a big concern for them, not just as an institution, but as a state. One thing I read that they've done interestingly, and I think maybe they've done this at RIT, is they started testing sewage as sort of an early indicator of finding COVID in the wastewater. So I was wondering if you came across any of that. It's something that I've only read like small snippets of and haven't really dug into, but it seems like an interesting technology if you can sort of have these early indicators of outbreaks, without the intrusiveness of testing individuals.
Well, actually, I didn't come across that piece of information, but yeah, it really sounds an effective like technology to do with the early testing.
Aaron, I've also seen something like that. I was looking up like when the first thing happened in Italy again, and they said something that a couple months beforehand it was found in the sewage as well, which is really interesting.
Wouldn't the intent be more towards finding the individual? Because I mean, in terms of the whole concept of trying to contain the virus is that you're going to find people who are infected and make sure that they sort of socially distant. So I'm not entirely sure how this might
I think so, but I think since this disease is kind of unique in that so many people are asymptomatic, I think it's just sort of it's just one other way of kind of finding an early indicator, because I think what we saw in New York is once people start testing in great quantities, it's too late. Like the virus, like testing individuals is a lagging indicator. I think testing sewage could be potentially a leading indicator in that you could be finding hotspots before before there's an outbreak. So take the case of New Rochelle. That was one individual that brought the virus into that community. By the time they had enough people tested to realize this is an outbreak, it was too late. But if they had testing in the sewage, they could have identified that earlier, shut that down, and potentially stop the spread. I think that's the thinking behind why you might want to test sewage.
Yeah, I agree with that, especially considering the virus really spread quickly. So I think the early that it can be detected, that would be the best. Yeah.
Yeah, that's a great point. Thank you, Erin, for bringing that up.
Can I quickly make a point?
Do you want to show a graph?
Yes, actually, I want to show a Twitter feed. So if I quickly share my screen, here's an idea of using pooling to increase the number of, increase your testing capability. So the main idea is binary search. Okay, so you pull, say, 16 samples together. If all are negative, you don't need to go into the details of those 16. But then if it comes out positive, you can, split them into halves, and then you can just take, one half at a time, and that can, accelerate your capability for testing. So I think a similar algorithm might be deployed for the sewage data as well. I think it's a really interesting way of doing things. Yeah.
Excellent point. Yeah, excellent.